Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Thank you, Rachel.
Good morning.
Good morning.
This
good
is
morning.
early for you to be here. The sunrise is just starting, Dr. Mencia.
Yeah, it is. It is. My friend Richard is growing a mustache again.
Yeah, right. I always wonder, if that's not, or your conversation this morning is on vacations, but I wondered, when you grow a mustache, do you ever have ingrown hairs, and could it ever be a problem for you?
I never grow a mustache, but
thank goodness I don't want you with a mustache.
I don't think so. I think if the person is prone to ingrowing hair, then yes. But if a person is not prone to ingrow hair, like on the beard area,
you actually can be prone to that.
You can be prone, yeah. If the hair tend to swing back inside, those are the individuals that have tendency to ingrow hair.
Okay, well, I want to talk about traveling. All my friends are going places, they're doing things, they're going
let's talk
on
about
cruises.
Traveling.
So,
Ina is going on vacation.
Yeah, right. Yeah.
She's going to Russia, Legoland, Orlando, Russia.
Orlando, Florida.
Well, but it's the time for people to travel. It's hot outside, and everyone's excited about going. They
so
drive.
take some note, Ina, because
Yes.
this is important to you. You have
pencil talk, I know.
Yeah,
right,
pencil talk.
Pencil talk, and you have a young son that he's going with you, right?
Of course. He's the only company.
Yeah.
And
do you ever think about taking, let's say, Tylenol or Advil with you when you?
I always have Advil in my purse.
In your purse, very good.
Oh, I don't do that. Why would I want to do that?
Well, because sometimes when the kids go out, they might develop a little fever, and you might want to have some Tylenol to give them so that they enjoy themselves during the vacation. You don't have to run to a hospital or anything like that. A lot of times it's just a viral infection, so it's good to have your Tylenol and your Advil with you.
But what about for older people? Should they be having things like that too?
Well, yes, let's talk about family in general. Yes, traveling came to my mind because yesterday I had a young guy in his 20s. He was here visiting his mother, and he was cutting potato, and a big portion of his palm came off. I mean, completely came off. So I used to take care of his grandma was my patient. She passed away. And so they brought him in as a new patient. He has insurance, so they brought him in so we can suture him. But when you go from side to side of the wound, it was so separated that I say, no, we cannot even do suture here. It was like almost half an inch distance between, side and side. So if I try to bring the skin together, your hand, it's his right hand, he's right-handed. It won't, your hand won't function the same. So I'm going to send you to a plastic surgeon so they can do a skin graft. Huh. So we send him straight to the emergency room. I say, I want a plastic surgeon to see you. And I want them to take a piece of skin from your thigh and put it there and do a little skin graft. And we're going to call today to see how he's doing.
Good for you. So now is he here on vacation?
So he's here on vacation visiting. So I asked him, have you taken your shot, your tetanus shot and all of that? He doesn't recall any of those things. So when you travel, keep your record up to date. That's the first tip. You want to take your immunization record with you, especially if you're traveling out of the country. Mm-hmm. Mind you, this guy was just traveling from state to state. But nowadays, through the computer, through the internet, some of the medical practice that are state-of-the-art, like we are, our records are in the cloud. And being in the cloud, that means that you can submit your email to one of my assistants, and they will send you a password where you can access your record from Russia or Germany or wherever you are, or just around the corner. You can look at your blood test and look at some of your data that might be pertinent in case of an emergency. So, try to know what your doctor, what they have. If they don't have record like that, because they are not state of the art.
That's really good that you have that. I see that. So
get copy of your blood test. Just get a piece of paper. And some of my patients, they are not computer savvy, and we just print a copy. So we still can have copy machine and paper. And for those patients, we print a copy and give it to them.
Do you know that I have Bill's because I don't take medication, but Bill does. I have his medication in my wallet. All the medications that he takes.
Very good. So let's talk about the wallet. If you're traveling, what do you want in your wallet? You want your allergies. Now, when you write allergy, don't make a list like banana, penicillin, what else? Omeprazole for my stomach. When you write, you say, okay, banana will give me a rash, or my lips swell when I eat a banana. Or shrimp, my lips swell when I eat shrimp. If I take penicillin, I cannot breathe. My throat swell, and they almost intubated me. So I'm going to say penicillin is a very severe allergy. So don't put, because if you let's say you are in an accident and you are in a coma and they pull out that list, should I give you penicillin if you need? Or so let's say if somebody tell me that penicillin gave them diarrhea when they took it, that's not an allergy. That's a side effect of the penicillin. They probably gave you too much penicillin. If somebody say, well, I eat a banana, I get upset stomach. That is, that doesn't mean you are allergic to the banana. Just, one of the side effects that you might get from eating certain food. So when you call allergy, you mean that you cannot be given that medication. And certain food, for example, if you are allergic to shrimp, we usually don't want to give you diet contrast because there's a cross reaction in the iodine, in the diet contrast and the shrimp. So usually when we hear that you are allergic to shrimp, we are very cautious. If we have to give you contrast, then we have to have all the tools ready to treat you for an allergic reaction.
So what you're saying is, in essence, if you wind up in an emergency situation and you say that maybe seafood, that you're allergic to seafood or shrimp, then they're not going to be able to give you maybe something they would normally give you.
Exactly.
And it could cause
that could be a life-saving procedure.
Yeah, this is really important. What other kinds of things?
Well, let's say if your problem with shrimp is that you just don't like it, don't call it an allergy.
No.
What's your allergy with shrimp? Oh, I hate them. I hate the smell. Oh my God. That's not an allergy.
No. Yeah, I have someone that says that she gets, as you said, her
lips swell up like that.
And then they can close.
And the throat can close down. So allergy, we usually divide any allergy into mild, moderate, and severe. Mm-hmm. Severe means that you basically can go into an anaphylactic shock, and they have to put a tube through the or down here because the throat is so swollen they cannot intubate you. And basically anaphylactic shock means that can kill you. Those people should make sure they walk around with an epinephrine pen, because in case of any emergency, they can just shoot themselves.
What does that do?
The epinephrine stop the process and allow you to breathe until you get to the emergency room. It will save your life.
Well, what other kind of allergies are dangerous besides I've heard about?
Well, most of the medication, and some of them are very mild. I had a patient this week. She's the wife of one of the Armenian priests in the area, and it just so happened that a study came out talking about the medication that we use to decrease the acidity in the stomach, like Nexium and Omeprazole and all of those medications. making a correlation between that and people getting heart attack. So,
Really?
so she went to see her gastroenterologist, and the gastroenterologist said, "Oh, that study just came out, so I'm telling all my patients to stop the Nexium, stop all this medication because, they are really dangerous." So I went on the internet and I looked up the studies. It's not really conclusive. They are looking at this correlation, but they are saying we need to do a major study to see if this is true or not. But regardless, she said, last month when I saw my gastroenterologist and he asked me to stop, my itching went away. I'm not itching anymore. So that is a mild allergy that she has to Nexium. So it's good that she stopped for the right or the wrong reason. It's good that she did stop because now we found out that she has an allergy to Nexium. Now, she had taken in the past omeprazole, which is another proton pump inhibitor for the stomach, and she had never had that itching. So sometimes when you have a person with itching and stuff like that, the best thing to do is stop a lot of those medication and find out. But allergies are important, and you want to, if you're going to travel, you want to put on your list not only what you are allergic to, but what happened to you when you are on it. Because if, for example, if a person has a mild allergy to penicillin and they develop an infection of the heart, of the inside portion of the heart called endocarditis, it is the best treatment still today is penicillin. So what we normally do, a person with a very mild allergy, we desensitize you to the penicillin. So what we do, we dilute a lot of the penicillin and give you just a little bit to provoke your allergy. And then we keep increasing the concentration of penicillin compared to liquid until we feel that we now can give you a full dose and your body will accept it. So it's important that you describe your allergy and what you have in case of an emergency. Then after allergies, you want to talk about your medications. Like, for example, for Bill, you have his medication in your wallet. You want to talk about the medications and what. So let's say you take Nexium. What is the strength? 40 mg. Okay. How often do you take it? Most people is once a day. Some people have to take it twice a day. So you take it twice a day. And what are you taking it for? Because I have a bleeding ulcer 2 years ago. So you can put Nexium 40 milligrams twice a day, and the reason was because of a bleeding ulcer. That is important because if you take it because you have GERD, that reflux coming in, and you have an accident, and I don't give you the Nexium for a week, as long as I keep your head elevated while you're in the hospital, you're going to be okay. But if you have had a history of a bleeding ulcer, I better replace the Nexium ASAP. Because during the stress of the hospital admission, you're going to bleed on me again. So if you take Colace, you take 100 milligrams, you take it once a day or twice a day, and you take it for constipation. Some of the medication that we take for constipation are not really for constipation, are meant for irritable bowel syndrome, IBS. So if you are not taking a medication for constipation, but you are taking it for IBS, the person with constipation, I may say, well, if you are not eating, you don't need prunes, right? If you are not eating, you won't need the prunes. But if you are taking something for IBS and you are in the hospital, guess what? The IBS can get worse. So I want to give you your medication to treat your IBS because you are not being treated for constipation, but for IBS. So make a list of your medication, the name of the drug, the concentration, the frequency, how often you take it, and why do you have to take that drug.
Very good advice, Dr. See, I'm listening to you. And actually, we're talking about vacations, but I think even if you're here locally, I think you should have it
You should have that with you because,
sounds great.
A lot of times you ask the doctor, I don't know why I'm taking this drug. And sometimes, you end up in the hospital and they send you home with drug that you really don't need, but you go to your primary care doctor and say, okay, they gave you this, so I just keep writing it. and you keep taking it, and you don't know why. Your primary care don't know why. And why take all this chemical if you really don't need that stuff? Get off from it.
I want to ask you a question because you've been talking about allergies. On many packages, it says this is manufactured in a plant with peanuts and something else.
Right.
I forget what the other thing is. And why are people allergic to peanuts also?
Some people are so allergic that I have a patient of mine that he said to me, when I walk into the house, if my wife is doing any cooking that have to do with peanuts, they are Indian, and he said, if she's doing anything that have to do with peanut, I feel the allergy coming in. I have to walk out and stay outside the house. So stepping through the door into the house and the kitchen being away from you. So some people are so allergic to peanut, and that's important. I had one of those drug reps, and we went out for dinner one time, and thank God he had his EpiPen with him. The waiter brought some medication in. Sorry.
Well, that's okay. And I'm glad we're talking about this because I really haven't, and I don't really understand about the EpiPen, but go ahead. You can tell us about it.
The waiter brought some appetizer, and it looked like chicken. It looked like chicken. We grabbed. Another doctor that was sitting there, they grabbed some, they ate. I said, the chicken tastes so delicious, So we eating chicken. The guy said, grab a piece. And I said, He grabbed it and he bite it. He said, it's not chicken, it's shrimp. Really? No, it's chicken. So we are debating. He said, I'm telling you it's shrimp because I'm allergic. So he pulled out his EpiPen and he started swelling right in front of us.
Oh, my goodness.
So he pulled out the EpiPen and we grabbed it, we opened it, and we gave him a shot right over his clothes because he was like swelling by the second. So, the EpiPen is a little pen that you carry in your purse, and it's epinephrine, which is the treatment of choice. Let's say for an asthmatic patient when they are shutting down, the treatment way back when it used to be an epinephrine shot. And they will open the asthmatic patient so you avoid the exacerbation of asthma. So anything that have to do with the lung closing down, shutting down, swelling up, epinephrine, especially an allergy, is a lifesaver. So in that case, we were, able to inject our representative from the pharmaceutical company with the EpiPen and save his life.
So that's why people will say, well, what's in this? But sometimes people with allergies, they'll say,
Exactly. It's a true allergy. When you see the people like that being so cautious, it's a very, it's a true allergy, and they can get really sick.
But do you think that then older people aren't going to travel because of all these problems? They're afraid to be away from their doctor?
No, they should travel. I think traveling is good. My father used to say, you either read books or you travel and and learn about the world. So we used to like to do both. We like to read and to travel to places. You learn about other people's cultures and stuff. But when traveling, you want to make sure that I'm just getting my text.
You see, he is so he can't keep that phone down, right?
No, I gotta just end the thing. Is Wendy? We're watching. Wendy is the one that sent me my picture from the sunrise. Now I had to send it to her. I had to.
You're never
so
missing
she's
a trick.
in Georgia. She's listening to us.
And that's wonderful. Okay, so
traveling is so important. It's so important to travel, I think. And regardless with all the trouble in the world going on today, we need to travel, especially just right here in our country. So many things to see.
I want to give a good traveling tip.
Okay.
Especially for an older adult. There's nothing like having a scarf that you keep with you.
Yeah.
Because, and you can explain this, and I don't know why. I learned about this when I lived in Minneapolis. When I kept my neck warm, my whole body was warm. And so even today, when we have cold weather, I always have a scarf around, put it around my neck. I have one in my car because if I get cold and I put that scarf on, what is it up there?
The scarf, your thyroid is very, very superficial under the skin, right under the skin. As a matter of fact, when we want to do a needle biopsy of the thyroid, we don't even have to open your skin. We just take the needle and put it right under your skin where the thyroid sits, right at the base of the neck in the front. And we can, with the needle, we can just take a biopsy of your thyroid. It's so close to the surface. And there's no muscle right in front of you. So it's skin and gland. So the thyroid, as we know, is very important in metabolism, for the metabolism. So when you put the scarf on, you are basically covering your vocal cord and that gland, and that will prevent you from getting sick. When I used to be a single in my previous life, I'm just kidding. I was never a single.
But you brought
when
up
I
the
sing,
fact.
people walk away.
No, but you're right. The singers always have the scarf around their throat.
To protect their vocal cord.
Just saying this because when you fly in an airplane, wherever you go, sometimes the coolness is right on you, and so people can get sick. And it's also another benefit because if people are sneezing, you just put it across your mouth, and it almost acts like. So I would add to your little travel. Right, you're traveling. Get a scarf.
I like that. Yeah.
Okay.
Yeah,
See,
I
made it hit today.
Yeah.
Okay, so now we're traveling. Now, how about...
I used to wear my scarves, yeah.
You did, you did.
Except one day I went to the psychiatric hospital and I have a 92-year-old lady that was admitted for severe depression. And I met her for the first time at the psychiatric hospital.
You gave her your scarf, I'm sure.
No, it's worse than that. So I say, "Hi, Mrs. Smith, how are you? Why are you here?" And she goes and grab my scarf with the two hands. She said, "Because I'm so depressed."
And she cried in your scarf.
And cleaning her nose with my scarf.
That was the end of the scarves, right?
So I say, "No more scarf."
Now she'll take your tie. We have to be very careful.
But I used to get up like 3 o'clock in the morning to be out of the house by 4. So because I used to run to a lot of hospitals. When I first started, there was basically very few geriatricians in the area.
There still are very few.
There's still very
frankly.
few. It's such a huge demand. But the scarf absolutely is an important tip. And if you are traveling, people that live here in Florida, acclimation. If you're going to travel to Canada and it's still cold, then you have to make sure you bring the proper clothes with you because you are used to the warm weather here. And then if you're going to travel to one of the islands, be ready for the mosquito, right?
So how do we get ready for mosquitoes?
Well, with the repellents and proper clothing, you want to go. In Florida, we like to wear the shorts and all of that. But once you travel to, the water is a little bit more contaminated in some of the islands, and just the stasis of the water not moving from, one point to another one. That's a reservoir for mosquito to come in and malaria and what have you. So if you are traveling, talk to your doctor where you're planning to go to see if you need any vaccination, you need to take antibiotic. And I have patients of mine that suffer, for example, from chronic bronchitis. And they are doing fine. And I say, let me give you at least a Z-Pack or give you some antibiotic for a week. You might not use it, but take it with you. Don't take the prescription, take the pills with you.
You are very good. That is
and,
smart.
that way you are prepared. Take some Imodium in case, you travel to a place that the food is not clean and you start getting a little diarrhea. Take some Imodium with you so that you can take care of yourself.
Wait, I'm not letting you get off that. I have a question.
Diarrhea.
I know that. But Coca-Cola is amazing. I always take a can of Coke with me because there's something in Coca-Cola, and I never drink soda. When you're sick, I'm from New Mexico, you have soda. And I've stayed on soda sometimes for a day or two when I'm, something's happened, I must have eaten something wrong. There's something magic in Coca-Cola, and I don't know what it is. They never...
Or ginger ale. Sometimes if you get a little upset stomach, people sip on ginger ale and is soothing to the.
So for me, I usually in my suitcase I keep a can of Coca-Cola. I have one usually in my
And
trunk
that's
too.
interesting you say that, because people think, well, if I'm in another country, I can just buy a Coke over there. But guess what? Let's say Colgate, the toothpaste company, they produce toothpaste here, but they have a factory outside in Latin America, and Coke also. So those companies, those large companies, those products that we use in America, sometimes when you buy it outside, they are not the same.
And we have to say goodbye until after the news. We're coming back again for another half an hour.
Oh, the news.
Everyone stay
the news.
with us because we've got lots of new vacation
Open the bottle.
tips. Right, open the bottle. Right. We're all going to have Cokes. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.